At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Hord.
Welcome to the Prevent Blindness Focus on Eye Health podcast, and thanks for listening. In our April podcast, we're going to focus on some issues of women's vision and eye health. Numerous studies have shown that women are more likely to experience a variety of eye conditions. There are both genetic and societal reasons for this. At Prevent Blindness, we feel the issue deserves special attention. Plus, the larger issues of vision and eye health apply to us all. Our guest today is Dr. Sherrol Reynolds. Dr. Reynolds is a prominent optometrist, administrator, and educator. She has a broad perspective on topics relating to women's eye care, women in healthcare, and more. Of course, we'll have news and announcements of interest to the blind and low vision community and our allies, and a peek at next month's episode. I'm your host, Christopher Hord. Keep listening. It starts right now.
News.
Join Prevent Blindness at a webinar supporting children's eye health. We invite all interested parties to join us for a free 2-part webinar titled A Shared Vision. The webinar focuses on building community partnerships to support school-based children's eye health programs. The webinar will be hosted by the National Center for Children's Vision and Eye Health at Prevent Blindness and our partners. Our partners are the School-Based Health Alliance and the Association of Clinicians for the Underserved. The webinar will be of special interest to community health centers, school nurses and administrators, and everyone interested in promoting children's eye health in school-based settings. The webinar takes place on Thursday, April 23rd, from 3 p.m. to 4 p.m. Eastern Time.
Feature presentation.
Greetings. Our guest today is Dr. Sherrol A. Reynolds. Dr. Reynolds is both a healthcare professional and an educator, and a leader in optometry. And we're going to talk to her about some issues relating to women's eye health and some other eye health related issues. Thank you for being on the program today, Dr. Reynolds.
Thank you so much for having me. It's a pleasure to be here.
To get started, why don't you tell us a little bit about yourself, your background, so folks know you've got a remarkable level of expertise, and just hit some of the highlights for us.
Well, again, thank you for having me. My name is Dr. Sherrol Reynolds, and I am a professor of optometry at a university in South Florida, Southeastern University, College of Optometry. I've been practicing, Chris, for over 30 years. Can you believe that? I graduated approximately 30 years ago. My journey to becoming an optometrist is similar to many other amazing, young, bright, young individuals who dream of being an optometrist. One, we don't know about the profession. So I graduated high school. I went to the University of Florida. I was in pre-med, and, there was a different direction for my life. And so in my senior year, I thought about eye care and eye health, and partly because personally, as many individuals who are listening, they have been impacted by someone close to them in their family, friends, that they know that have lost their vision. So my aunt lost her vision from diabetes. And so I was, intrigued as to why my aunt lost her vision. And so I did some research. And when I graduated, the internet didn't exist. So I did some research on, different professions that provide eye health care. And optometry was one of those professions. And I have been going to an optometrist for a long time. So I spoke to my optometrist about the profession, Chris. I applied, I took the optometry admissions test, and I was fortunate enough to be accepted into a program. It was Southeastern at the time, and then they merged with Nova. So I graduated from Nova Southeastern University College of Optometry. I do want to share on this journey. So I've been an optometrist for a long time, but one of the biggest things that has impacted me and made a difference in my journey is mentorship. And so I was fortunate to have great mentors in my life, leaders in the field of optometry. And therefore, I have, sort of pursued that, being a leader in the field. I've been president of the National Optometric Association, so I'm past president currently. And that organization, Chris, is dedicated to advancing visual health in undersupported communities. I've been fortunate to be part of Women in Optometry, an organization dedicated and focused on uh, women's eye health. As we talk about March being Women's History Month, women's eye health is so critically important. I know we're going to have more of a conversation about that. And I've been fortunate enough to partner with Prevent Blindness as well as the National Eye Health Education Program, a branch of the NEI, in creating Eye Health, My Health. I'm co-chair of that initiative. And so for me, this journey, this platform, it's so important to increase awareness about eye health conditions because, Chris, I don't know if you know, the most feared loss is not a loss of a toe or a finger, it's loss of vision. So vision is so critically important, especially in undersupported community or women community and all communities.
Okay. And thank you. Now, you mentioned a little bit talking about especially the relationship between women and eye health. Now, I understand that in your work, you've done a lot of work relating to that, and among the many honors you've received, you've just gotten recently a very prestigious award. Could you tell us a little bit more about that?
So I was deeply humbled and honored to be nominated and selected to be a recipient of Vision Monday 2026 Most Influential Woman in Optical. That is such an prestigious award, and I'm humbled by it because I know that my journey here is not of my own. I definitely stand on the shoulders of those women that have come before me who paved the way for me in this profession. Again, as we celebrate Women's History Month, I just want to just recognize that I am here because those that have come before me have paved the way.
Okay, thank you. Now, while we're on the topic, I'd like to go a little further on that because we are talking about Women's History Month. We're talking
Mhm.
about women's eye health specifically. And I'm hardly an expert in the field, but I do know, or my understanding is that statistically, women are more likely to get various eye conditions than men. Um, is there anything you would say as far as particular advice or tips to our women listeners who are maybe concerned about their eye health?
Yeah, thank you for that. You're absolutely correct. Women are disproportionately more impacted from chronic diseases, number one, systemic diseases such as diabetes, hypertension, hypercholesterolemia, as well as eye conditions. They're more likely to not only have these eye conditions such as glaucoma, macular degeneration, diabetic retinopathy, hypertensive changes, but women are disproportionately more likely to go blind and have visual threatening complications from these conditions. So I just partnered with a podcast that talked about eyes on the heart. And a lot of times as women, we don't understand how important our systemic health is. Women, I would say, they do so many things. Not that men don't, but I think that women are doing a lot and they're stressed and they're working tirelessly and they don't put their needs or their health at the forefront. So my recommendation for women today is to make sure that not only are we taking care of our systemic health, but we also take care of our eye health. Did you know, as a woman and as any patient, that we can detect underlying chronic diseases? Early changes in the blood vessels in the back of the eye, Chris, can be an indication of stroke risk. In some cases, a stroke risk up to 3 years when we see early changes, bleeding in the eye, an eye stroke. Those are indication of chronic systemic conditions, such as high blood pressure, high cholesterol, diabetes impacting the eye. And an eye exam is so critically important to detect those early changes, Chris, so that the patients don't lose their vision. So if there's one thing I could leave with the audience today, specifically the women in the audience, is to get a yearly comprehensive dilated eye exam. It's so critical, not only in detecting early eye conditions like glaucoma, which is the silent thief of vision, or hypertensive change, the silent killer, diabetic changes, but any changes in the eyes. It's so important to detect them early, intervene early, so that we can prevent vision loss of these conditions.
Great advice. Thank you. Now, while we were talking about the various conditions, and you also mentioned this a little bit earlier,
Mhm.
is part of your journey was influenced by eye conditions related to diabetes.
Yes.
And once again, that is a topic that is very, very large and significant in the community.
Mhm.
Can you tell us a little bit more about your work with that?
So, yes, diabetes and its complication, again, disproportionately impact undersupported communities. And it's, again, women are more likely to suffer from complications of diabetes. I've been fortunate enough to partner not only with Prevent Blindness, but the American Diabetes Association and educating patients about this condition, as well as the National Optometric Association. One of our initiatives is our Three Silent Killers initiative, and that initiative is basically to increase awareness around chronic conditions, not just diabetes, of course, but high blood pressure and glaucoma. And we call these conditions the silent killers. And what that means is really these conditions don't have symptoms until a lot of times it's too late. And the statistics are important. In the United States right now, half of the United States population, Chris, have diabetes, or they are at risk of developing diabetes with prediabetes. So it's just really important to educate patients on the importance of a comprehensive eye exam. I'm also fortunate to be a chair of the National Eye Institute, National Eye Health Education. One of their initiatives is Eye Health, My Health. And so I'm co-chair of that initiative. And that, again, is to increase awareness around these chronic conditions, including diabetes, high blood pressure, glaucoma, high cholesterol that can impact the eyes, to educate patients on these ocular and systemic complications, and again, just the importance of a comprehensive eye exam as part of your overall health care.
All right. So I think, obviously there's a lot of things for folks to keep in mind, but I think if there's any one main takeaway here, it is that regular preventive care is very vital to people's health.
Yes, exactly. And also to remind the audience that you can see very well, Chris. Patients always say, oh, it's not affecting my vision. My vision is good. But vision is just one aspect. Seeing is just one aspect. I always tell my patient an eye exam is more than checking for your vision. You can see 20/20. It's checking for your eye health. And eye health is totally different. You can have bleeding in the back of the eyes and still see 20/20. So if there's one thing I want to leave, one message is that an eye exam is more than just giving glasses or contact lens. We can detect early changes and therefore we can prevent complications. And more importantly, Chris, we can save our patients' lives.
Fantastic information. I want to thank you for joining us today, Dr. Reynolds. And while I've got you here, are there any other topics or initiatives you're working on? Anything coming up that you'd like to make our listeners aware of?
Yeah, so we're continuing our work with our Eye Health, My Health with the National Eye Health Education Program. The National Optometric Association, an organization that I'm very proud to be part of, and also I'm currently president of the foundation, is not only just working on these initiatives to increase awareness, education about these conditions, but mentorship and guidance. So we're working on various projects and programs to increase awareness about this amazing profession that I love, mentorship and guidance for young, amazing individuals that dream of being an optometrist and giving back to their communities. We're also working on an initiative that might introduce this profession earlier to high school students so that they can think about being an optometrist and giving back to their communities. We're working on our Serve Where You Go initiative, which is our yearly conference. We have a community outreach. We're taking an eye exam with a mobile eye clinic. We partner with companies that provide mobile eye clinic to provide comprehensive exams and screening to individuals in the communities that are not as supported. So these are a lot of the things that we're doing, but I'm so proud and so elated to be part of that. Giving back is so critically important.
Yes. Well, thank you. And finally, to kind of sum up a little bit, obviously we've touched on a great many topics here in the course of our interview, but if folks would like to try to find out more or follow up on some of these, are there any particular, say, websites or organizations that you would recommend as a kind of jumping off point for people who would like to get more information?
Yeah, so definitely they can go onto the National Optometric Association website. The American Optometric Association website provides a lot of literature on eye health. The American Academy of Optometry website, Prevent Blindness. The NEI, NEHAP, National Eye Health Education Program, provides a lot of information and brochures and infographics for patients. And also I've been fortunate enough to partner with some local other organizations, such as the National Nursing Association, to provide webinars for our patients. So there are various ways, and you can definitely contact me. My name is Sherrol, Sherrol, ray@gmail.com, and I'm more than happy to answer any questions that your audience may have. And again, it's Women's History Month. This is an important month. All months are important. But again, just to let the women know in the audience, please get an annual eye exam as well as part of your eye health, your overall health care.
That is a great note to kind of wind up on. We want to thank you so much for being a guest on our program today, Dr. Reynolds.
Thank you.
And just thank you for your excellent work.
And thank you for having me. It was a pleasure to be here.
Announcements.
Prevent Blindness observes April as Women's Eye Health and Safety Month. Statistically, women are more likely to experience eye conditions than men. The World Health Organization estimates that women make up more than 64% of the visually impaired population worldwide. This is a serious issue worthy of consideration. That is why Prevent Blindness observes the month of April as Women's Eye Health and Safety Month. Prevent Blindness provides a variety of resources, including web pages, fact sheets, and expert videos. These can help you learn more about eye health and conditions that uniquely affect women. We invite you to explore our resources and to share them on social media. Please visit our website at preventblindness.org or click the link in our show notes.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
This has been the Prevent Blindness Focus on Eye Health podcast. Thanks for listening. Please join us next month when our guest will be Emmy Award-winning performer Ellen Gould, an actress who has found success on the stage and the screen despite vision loss due to Stargardt disease. As always, we'll have news and announcements of interest to the blind and low vision community and our allies. And please ask your friends and allies to become listeners and join us on our journey. I'm your host, Christopher Hord. Until next time, share and enjoy.